Hey there, welcome back. Today we're diving into something super important for your health. Hypertension or high blood pressure. You've probably heard of it, maybe even know someone dealing with it. But do you really know what it means and how it affects your body? Stick around, because by the end of this video, you'll know what hypertension is, why it's called the silent killer, and how you can take control of it. All right, let's get into it. Let's start with the basics. Blood pressure is the force of blood pushing against the walls of your arteries as your heart pumps. It's measured using two numbers. Systolic pressure. This is the top number. It measures the pressure in your arteries when your heart beats. Diastolic pressure. This is the bottom number. It measures the pressure when your heart is resting between beats. A normal blood pressure reading is below 120 over 80 millimeters of mercury. But if it consistently creeps above 130 over 80 millimeters of mercury, that's considered hypertension. Think of it like this. Your arteries are like a garden hose. If the water pressure inside the hose gets too high, over time, it can cause wear and tear. The same thing happens to your arteries with high blood pressure. Now, why is hypertension such a big deal? Here's the thing. High blood pressure doesn't just affect your heart, it affects your entire body. Here are some of the major risks. Heart disease. Your heart has to work harder to pump blood, which can lead to heart attacks or heart failure. Stroke. High blood pressure can cause arteries in your brain to burst or clog, leading to a stroke. Kidney damage. Your kidneys rely on healthy blood vessels to filter waste. Hypertension can damage those tiny vessels, leading to kidney problems. Vision loss. It can also damage the blood vessels in your eyes, affecting your sight. And here's the scariest part. Hypertension usually doesn't have any symptoms. You could be walking around feeling perfectly fine while damage is happening inside your body. That's why it's called the silent killer. Let's talk about what causes hypertension. Some factors are out of your control, while others depend on your lifestyle. Here are the uncontrollable factors. Age. As you get older, your arteries naturally become stiffer, increasing your risk. Family history. If your parents or close relatives have high blood pressure, you're more likely to develop it. Ethnicity. Studies show that some ethnic groups are more prone to hypertension due to genetic and environmental factors. But don't worry, there are plenty of risk factors you can control, like diet, high sodium, processed foods, and sugary drinks all raise your blood pressure. Physical inactivity. Sitting all day isn't just bad for your back, it's bad for your blood pressure too. Stress. Chronic stress can keep your blood pressure elevated over time. Smoking and alcohol both damage your blood vessels and make your heart work harder. Take salt, for example. Did you know the daily recommended limit is just 1 teaspoon? Most of us eat way more than that without even realizing it. Now let's talk symptoms. Most people with hypertension don't feel any different, but in severe cases you might notice frequent headaches, dizziness or blurred vision, shortness of breath, chest pain. But don't wait for symptoms to appear. Get your blood pressure checked regularly, even if you feel fine. Take a moment to zoom out and look at hypertension on a global scale. Did you know that high blood pressure affects over 1.2 billion people worldwide? That's roughly 1 in 4 adults, and the numbers are rising every year. In fact, hypertension is the leading preventable cause of heart disease and stroke globally, responsible for an estimated 10 million deaths annually. To put that into perspective, that's more than the population of some countries. Interestingly, the prevalence of hypertension is highest in low and middle-income countries, where nearly 2/3 of cases are found. This is often due to limited access to healthcare, lack of awareness, and fewer resources for diagnosis and treatment. But even in high-income countries, hypertension remains a major public health challenge. And here's a shocking statistic. Nearly 46% of adults with hypertension are unaware that they have it. That's almost half of all cases. Why? Because high blood pressure doesn't always have noticeable symptoms. That's why it's often called the silent killer. Beyond health, hypertension also places a massive economic burden on individuals and healthcare systems. In the United States alone, it costs an estimated $131 billion annually in medical expenses and lost productivity. And globally, the cost is immeasurable when we consider the impact on families, communities, and entire economies. The good news? Hypertension is preventable and manageable, but it starts with awareness. By understanding the scale of this issue, we can all take steps to protect ourselves and those we care about. So let me ask you this. When was the last time you had your blood pressure checked? If you're not sure, this might be the perfect time to take action. Okay, so how can you prevent or manage hypertension? The good news is small changes can make a big difference. Here are 6 tips to help you get started. Eat a heart-healthy diet. Focus on whole grains, lean proteins, fruits, and veggies. Cut back on salt, sugar, and processed foods. Stay active. Even 30 minutes of walking a day can lower your blood pressure. It doesn't have to be intense. Just move more. Quit smoking. Smoking damages your blood vessels, and every cigarette raises your blood pressure. Quitting is tough, but it's worth it. Limit alcohol and caffeine. Moderation is key. Too much alcohol or caffeine can spike your blood pressure. Manage stress. Try relaxation techniques like yoga, meditation, or even deep breathing. Chronic stress can take a toll on your heart. Check your numbers. Use a home blood pressure monitor to track your progress and share the results with your doctor. If your blood pressure stays high despite lifestyle changes, it's time to see a doctor. They might recommend medications like diuretics or beta blockers to help manage it. Remember, medication works best when paired with healthy habits. All right, now you know what hypertension is, why it's so dangerous, and how to keep it under control. The key is to take small, consistent steps toward a healthier lifestyle. Don't forget to check your blood pressure regularly and share your numbers with your doctor. Together, we can beat the silent killer. If you found this video helpful, give it a thumbs up, share it with someone who needs to hear this, and subscribe for more health tips. Thanks for watching. Take care of your health.